Good morning, ladies and gentlemen. I'm by names of Marie-Jeanne Akimanzanye, and I'm here to present to you about EHR. So EHR simply means electronic health records. So electronic health records are computer-based systems that medical practices use in recording and managing patients' information instead of using paper charts or writing with a pen on the papers. So it is a longitudinal electronic record of patients' health information, and it's generated by one or more encounters in any care delivery setting. It includes information, patient information, demographics, progress notes, problems, medications, vital signs of some diseases, medical history of patients, immunization, laboratory data like if a patient ever took a certain test, and radiology reports. So basically, I'm going to talk about 5 components of EHR. So I start by patient management. So patient management deals with patients information such as contact details, demographics, insurance, and even registration for the first time. Like, for example, if a person comes for the first time, like, they are given ID so that the ID will be used to identify the patient. So the patient's management component supports clinical care, since it involves the identification of a patient. So if there is an ID, like, it's a person have a certain ID, the information, the insurance, I think it helps clinical care, like being able to identify a certain patient so that they can be able to help them. So the component is used by both patients and deliverers. Why this is because they use to be able to identify patients, and also patients can use that just in case they are going to visit the healthcare provider. They know their IDs so that it's easy for them to communicate. The benefits, like, it is easier for deliverers to be able to identify patients, even know the information about the insurance so that they can know how to help them. It's so it is the issues is that sometimes if patients give unnecessary information, or if the information, like if there is a technical problem and the information is lost, they may fail to identify the patient due to technical problem. This integrates other clinical and administrative process, because it's the beginning of the process. So other administrative or workers wouldn't be able to work if this wasn't working, because you must be having patient their IDs and what they need so that to be able to identify the services they need. There's also clinical component. The clinical component is composed of other sub-components: electronic documentation, nursing component, and computerized physician order entry. So computerized physician order entry, the physician order entry is used to enter patient needs direct into the computer. Like, they be able to identify what a patient needs and enter it directly into the computer. And then the electronic documentation is used for documenting the notes, such as history of the patient, about the disease, physical, operative, and notes, and even consultation notes. There's also pharmacy system is used to fulfill, like, prescriptions, like being able to note that the patient needs this kind of medicine, this physical therapy, and whatever. So they use that to prescribe for the patient in the maintained drug formula. So nursing component allows collection of critical patient information such as vital signs, like being able to note the signs of a certain disease a patient might be having. So I think the clinical component supports clinical care. Why? It's mainly where you identify the patient's needs, prescription, vital signs of the disease, so that you can be able to help them. So the care providers use these to rate the patient's sickness with the medical prescription, to be able to conclude like what should be done, like what physical therapy should be given, what medicine should be prescribed based on the vital signs of a disease that have been identified. So this allows easy coordination of activities, being able to identify the patient's needs as the information and the history is entered directly. Also, if this may have limitations if the patient give wrong information, or if they confuse the deliverers by maybe with the IDs, or if there is any technical problem. So this integrates clinical and administrative process in which that it allows easy coordination of activities, like people are able to enter the information of patients, other able to see the test, prescription, what they need, and so it is easy for administrating all activities considering the patient. So the fourth component is the laboratory. Laboratory is a component of electronic health record, in which is divided into two subcomponents, namely capturing of results from laboratory machine and integration with the billing orders and lab machine. So this supports administrative processes. So how does it support administrative processes? It supports administrative processes in which that so people get to know the diseases. So if they know the diseases, they are able to prescribe medicines. And also it's administrative because the administrators would it makes them it eases their work to be able to control activities of the laboratory, the billing, and how it's going, like how the results are, and how which medicine should be prescribed, and how much should be paid based on the disease a patient is suffering from. So this is used by provider to be able to test, get results, be able to notice the disease in the patient's body, subscribe medicine for them, and even charge them depending on the cost of the test or even of the medicine subscribed. So the benefit is that there is identification of diseases, and this can help to be able to come up with the correct prescription, which will give quality care, like the patient would be able to have a quick recovery if they are given right medicine. So the issues might be if the lab machines are not well functioning, it might fail to identify the diseases. So it integrates clinical and administrative processes in a way that it coordinates activity of lab, medicine prescription, information, patient information, and billing. So the administration is all about that, and healthcare administration needs to know that, and that's how it rates with administration. The last component of EHR is radiology and billing. Radiology and billing is a kind of information system along with the pictures, archive, and communication system in useful managing patient workflow, like ordering procedures, images, and results. So this is an EHR component that supports administrative processes. Why? So it's about patients, information, charts, images, orders, and bills. And this is all about healthcare administration. Why? Because the healthcare administrators are in form of are in charge of knowing the patient's information, how they are suffering, the results, what they need, and what should be done to improve their health based on the charts. Maybe if it's an incurring disease in a certain area or something, to be able to come up with something useful to help them. So the administrator use that to be able to coordinate activities by knowing who placed order, how she can meet the provider responsible to help them, and even how they can schedule the meeting together to be able to be helped. So the benefits is that there is easy communication among providers and patients, and even high quality of care provided as there is direct coordination of the patient and the provider. The limitation is that if the patients are not really able to use the platform, they can't be able to place orders or can't be able to give that enough information, it will be a limitation to the patient. It integrates with the other clinical administrative process in a way that they get information from the patients, know which kind of help he or she needs, but they interpret their chart so that they can be able to help the person based on their patient's history.